Good morning, everyone, and welcome to today's community call. Today we'll be talking about employees returning to the gym and some of the legal and rule and guidance challenges around that topic. As always, we'll start with a really quick Zoom tutorial. Make sure you guys enter all your questions into that question and answer box. We'll cover some ground rules, and then we'll just jump right into the meat of this conversation, talking about where to find resources to create your internal policies around COVID-19 and what's expected from you or from local and national organizations. And with us is Jason Pill, who was on a previous call discussing some of the labor law challenges around closing down. So, for today's call, as I mentioned, any questions that you guys might have, throw them to that question and answer tool down at the center of your Zoom screen. And you can also upvote those questions with a small thumb, and we'll make sure that as many questions as you guys have get addressed by Jason and us. During that question and answer session, if you have something that's too long for to type out, feel free to raise your hand. We'll unmute you and give you a chance to speak your piece. And you can also chat amongst yourselves with the Zoom chat tool, which is also at the center, bottom center of your screen. If you want to chat with everyone, just make sure you hit the little drop down and select all panelists and attendees. Our ground rules, as they always are, will be just to be polite and respectful of Jason, ourselves, and each other. Keep any personal political commentary out of this discussion, and if we do unmute you to speak, just keep your comments under 2 minutes. Anyone who is abusive to anyone, we will have to remove you to just keep the conversation flowing. As we start, I'm just going to hand this over to Jason really quickly, but just to make sure you guys know where to go if you have more detailed questions. A lot of the topics that we cover today will touch on areas where there's guidance from different health and safety organizations around the world. Here in the US, it's OSHA as the primary one. Different health authorities. Here in the US, it's the CDC is the primary one. A lot of these organizations have issued interim guidance and suggestions around how workplaces should be set up in the midst of the pandemic. And then you can also get a lot of resources on our blog at the CWA. Just in our last newsletter, we released a two-part guide on considerations for workplace health and safety during the pandemic. So I'm going to hand this over to Jason. If you guys aren't familiar with Jason already from his presentations at the CWA Summit, his work with the Climbing Business Journal, his previous work with us, he's got a background in climbing gyms, and currently he works in the area of labor and employment law, and I believe also cybersecurity as well, and also is the chairperson of the USA Climbing's Risk Management Committee. And so I'm going to hand this over to Jason, and I believe he has some slides for you guys, so we'll just flip that over if you can bear with us for a minute. And will we get...
Right, let me just get that set.
Yeah, I'll let you get that share started, and will we get that set up? I'm just going to give you guys a reminder that that poll is still live. We got about 3/4 of the people who've added their information. So I'm going to give you another maybe 20 seconds or so to get that in, and then I'll share the results as Jason kicks off.
Well, thanks, Garner. I'll go ahead and get started while we wait for those poll results to come in. But thank you, everyone, for joining us today. For those of you who I haven't been able to meet previously, like Garner said, I'm an attorney with the law firm of Phelps Dunbar. I work out of Tampa, but I work with folks across the country, and primarily I work with companies handling their workplace issues, employee disputes, policies, things of that nature. Also the chairman of the Risk Management Committee for USA Climbing, and do a good bit of work with the Climbing Business Journal. If you've ever read the Ask a Lawyer column in the Climbing Business Journal, I am that lawyer. So if you have questions, I encourage you to take them through there as well. And happy to see the poll results. It appears that a little over 1/3 of the folks on today's call are already open, and about half of the gyms are not open yet, but hope to be open by the end of July. So we appreciate that context. The focus of this presentation today, as you can tell from the title, and as Garnet said, is to talk about preparing your gym to reopen from a couple different perspectives, but primarily focusing on your employees. I'm going to start the presentation to talk a little bit about preparing your workspace, and we'll talk some about the OSHA guidelines and some of the other materials that are out there, and then we're going to talk about your workforce. That'll be probably the second half of the presentation. We'll talk about some of the employee issues you have to deal with, some of the employee laws that are out there, some of the new laws that are out there, and some of the existing ones that are now going to come into play. So I've got a lot of ground to cover, and I'll do my best to keep us on track here, but you'll see I do have some embedded links to these materials when we get there, so feel free after the presentation, if you need more information, you can email me, I'll send you the slide deck, and it's got more of these links, especially when we get into the OSHA part and get into those details. So as we all know, we're now at a point where the transition has shifted to reopening the gym. We have reopening the gym, so we've got about a third of the folks on our call that are already there, and more coming soon in these next few weeks, so certainly happy to hear that, but there's a lot of new complications. You can't just go back to business as normal. And in fact, the CDC has said, we don't expect you to go back to business as normal. There are going to need to be some modifications. I know the gyms that are currently open are already dealing with that, and you guys had a couple community calls on that already. I do want to direct you to the CWA's resources on this. If you haven't checked them already, I suspect most of you are familiar with them because you're on this call. But the CWA has their reopening guidance. It's on their website. It's going to cover a lot of the particular details in terms of cleaning and staffing and some of the OSHA requirements. I'm going to get into those specific details as we go here, but I just want to point you to that resource as well. They've done a great job aggregating that data. And also, one of the areas I kind of wanted to start with is to mention this Vertical Life survey. Some of you have probably seen this. It's a survey that Vertical Life recently put out. They got over 20,000 participants. Now, mainly pretty dedicated and what is it, probably hardcore climbers, so the data might be a little skewed, but they did get about 20,000 participants, and about 3,000 from the US asking them about gym reopening. And I know the font's a little small here, but the encouraging thing to see is that the overwhelming majority of climbers want to get back in the gym. I'm sure all of you know this anecdotally. You're either seeing it in your gym if you're open, or you're hearing it from your people. I'm excited. Today is the first day that my local gym, Vertical Ventures, they're reopening today. I'm in this group ready to go back in there. I'm sure you're seeing a lot of it as well. So the appetite to get back in the gym is there. How that translates to your non-members, that's a different issue. I don't know how much that's reflected in this survey, but at least with the climbers, you can see most are eager to get back in the gym, and some don't, the majority don't even worry about social distancing and hygiene measures. A small portion does want to see that, and then a very small portion doesn't want to go in yet. So thankfully, that appears to be something that the climbers want. I think we all kind of anticipated that. Also, this is an interesting slide they had about how willing the climbers are to follow certain safety precautions. We're going to talk about what your staff should be doing in a minute, but I just wanted to start with this. Everybody just about seems comfortable with hand hygiene. About 98% would be comfortable with those rules. Wearing a mask, a little more divisive, but still the majority would be comfortable wearing a mask. And then the majority of folks would expect you to make masks available. You certainly want to consider that for your climbers, and we'll talk about that a little more. So when we talk about reopening the gym from a safety perspective and the actual workspace, there's a number of areas out there to look, and there's a number of organizations putting out guidance, and quite frankly, it's extremely confusing. There's a lot coming out. I'm sure it's very overwhelming. You've got the White House, that's where this is from. The White House is issuing guidance. Most of the White House's guidance is issued through the CDC, although sometimes there's a rift there, of course. And then you also have OSHA, which is primarily being pushed through the Department of Labor, and OSHA is giving you more of the specific workplace guidance. So we're going to talk more about OSHA, but we do have some CDC references. And what you see here is just the general White House plan for, you know, quote unquote, opening up America again. And a lot of these themes that you see here, you're going to see as we progress through our slides. There's going to be questions about social distancing, protective equipment, temperature checks, sanitation, and just general cleaning. Now, business travel is not going to apply to most of your workers unless you're sending them somewhere, which at this point is very unlikely. But that's one of the other areas the White House is focused on. And what you're going to see from the EEOC is you're also going to be monitoring your workforce for symptoms. And not just your workforce, but because this is an industry where you have customers coming in on a daily basis, you're also going to want to be considering what extent you want to track your customers with temperature checks and things like that. And then the final note here is developing policies and procedures is key. This is what the White House or the CDC is focusing on. And here's the phases. I think a lot of folks have seen these phases now that the CDC has pushed out for employers. Now, this is, of course, very general. This is not specific to any industry and certainly not to gyms. We know that teleworking is not available for most employees or most gyms unless you have perhaps some admin folks that can work remote. But it does outline the phases. This is from the federal level. We'll talk about some state level issues, but I think we've all kind of seen this now. Most states are in phase 1 and progressing towards phase 2, and gyms typically fall in that phase 2 area. But again, it's going to be driven by your own state. This is just kind of the CDC's overall phased plan. So what we've got here is a specific slide from the CDC. This is kind of the roadmap that the CDC has laid out for whether you should be reopening or not. So this is something to consider if you haven't opened your gym yet, or you're debating about when or under what circumstances to open your gym. And you can see here it's broken down into these 3 columns. The first column is making sure, can you even be open under your local authorities, your regulations, your safer at home orders, your quarantine orders? Obviously, you've got to check that. That's going to vary by every particular gym location. And if you have multiple locations, you may have one gym that can open and others that cannot. As we're seeing, this is very localized, often to a specific county, if not, of course, the state. So you want to make sure you can do that. You want to make sure, of course, you can also protect your staff and your members. So, of course, that's the first column. You got to at least get through that kind of checklist before moving to the second column. And the second column is something I'm sure everyone's been thinking a lot about, is what type of hygiene measures do we have to implement? Obviously, they're a little different in a climbing gym, which is also like any fitness center where there's more interaction with customers coming in using equipment. So you obviously need to be tracking and looking at what type of cleaning and sanitation requirements you have. And then assuming you're comfortable with those safeguards, then you need to also consider what monitoring are you going to put in place? What are you going to do if an employee gets sick? How are you going to handle that? How are you going to monitor those absences with your staff? Once you're comfortable with all of that, that's when the CDC recommends, this is just all a recommendation, that's when the CDC recommends you're ready to open. So what I really want to focus on from OSHA is what OSHA is expecting. That was just the CDC's recommendation on the prior slide. Now we're going to look at what OSHA has, because OSHA is really getting more involved in the details about what its guidelines are in terms of PPE, the personal protective equipment, and sanitation and disinfectant and things like that. But critically, what OSHA has issued to date has been just that, guideline. It has been permissive and not mandatory, but we'll talk about why you still want to follow OSHA to the best of your abilities. It may not always be possible, but let me start by kind of explaining how OSHA has broken down the various risk factors, because once you figure out what tier you're in, as you see this pyramid here going from very high to lower risk, that helps you see at least what OSHA recommends for your workplace. And so it's got the 4 categories you can see from very high to lower risk. And I think the easiest way to figure out which category you're in is by figuring out the ones you're not in. And so I start very quickly just to point out, when we talk about these very high risk and high risk exposure workplaces and workers, what OSHA is contemplating there is what most of you also are contemplating: hospitals, mortuaries, places where the workforce is dealing with known or suspected COVID-19 infections. So this is not going to apply to gyms. So if you're looking at guidance, it's talking about very high risk workplaces or high risk workplaces. You're really not going to need to worry about that. This is for, as you can see, healthcare and medical facilities, not gyms and retail. So really, when we talk about climbing gyms, you're going to fall into one of 2 categories, either the medium risk or the lower risk exposure. And in fact, you may have workers that are operating in both of those environments within your same facility. So when we look at the medium exposure risk, what OSHA has articulated and considers to be this medium risk is where your workforce is going to be interacting, potentially within 6 feet, of customers or clients. And these clients aren't necessarily known or suspected COVID-19 patients. And that's what your gym is. You don't have any reason to suspect that these people coming in are COVID-19 patients. You're not treating them for that. You're not an ICU, of course. You're not an emergency room. So this is where you have your workers in contact with the general public. So this is how OSHA describes it, and this is where I think most gyms are going to fall. And when we talk about some of these occupational controls, these are some of the requirements that OSHA contemplates for a medium exposure risk workplace, and we're going to talk a little more detail about some of them. But you see physical barriers where feasible or appropriate. Sneeze guards are going to be appropriate for certain workforces, but perhaps on a climbing gym. Consider offering face masks to ill employees, keeping customers informed, strategies to minimize face-to-face contact. Now, this is what OSHA, like I said, provides. Drive-through windows and telework isn't really as applicable for gyms, of course, so we have to think about how we modify it to a gym setting. Communicating any screening with your employees, and whether you need PPE. And again, we will go into that in more detail. That's a medium risk environment. The medium risk environment, you're typically looking at folks interacting with the public. And to contrast that, and what some of your employees may fall under, is the lower exposure risk, which is someone who's having minimal exposure to the public. So this would be for any gyms that have kind of back of the house support staff and accounting, human resources, or management that's not interacting with the clients, not interacting with really the customers and the climbers. They might be in a lower risk where they don't need as much precautions. And you can see here, OSHA doesn't recommend additional engineering controls. You still should be monitoring those employees, making sure they can communicate if they have symptoms, and you can check on their symptoms, but they're not necessarily requiring additional PPE, so that's certainly encouraging. The question is whether you fall in lower or medium, and whether you should be offering any PPE to your staff. Do you need to be providing them face masks? Do you need to be providing them with gloves? That's where I suspect a lot of gyms have questions. So OSHA has, in fact, given us some industry-specific guidance. So they gave us that pyramid, said maybe you're medium risk, maybe you're low risk, but here are the industries. And then I have some very detailed suggestions, again, this guidance for what different industries should be doing. And as you can see here from this list, there's nothing for gyms. They're obviously not going to have something as specific as climbing gyms, but they don't have anything for fitness centers, at least not yet. Maybe they will, but they don't. So when we look at what's probably the closest corollary of this group, because obviously a gym is quite different than post-mortem care or airline operations, I would argue the most applicable guidance to look at, and the one that I would recommend you look at if you're reviewing OSHA guidance, would be retail operations. And we do have some guidance on that from OSHA, what you should be doing in a retail setting. Now, again, a gym's not quite like a retail setting, but you are having customer flow coming in, and you have no reason to believe these customers are suspected or known COVID carriers. So I think that's probably the most applicable guidance, at least for the time being. And this is a screenshot from OSHA's website. If you click on, let me go back from it. If you click on the retail operations from this site, it provides what may be two examples within retail where your workers may be in what's called this lower caution area if they're doing, like I said, these administrative duties or not interacting with customers. And then if you have your workforce in more of a medium exposure risk where they're interacting with customers, point of sale, in this case, checking in climbers, and whatever else you may be doing. I don't know if anyone's doing belay classes right now, but obviously if you're doing belay classes, there's going to have to be a little more closeness between the worker. You can't really teach a belay class from 20 feet away very effectively. So most of your folks are going to fall in lower or medium, and unless you have a lot of administrative folks, most of your workers are probably going to fall in that medium category. And we'll talk in these next slides what exactly that means in terms of PPE. It's still not required. OSHA's not requiring it, but they're suggesting for medium, typically considering a mask, and if they're doing certain cleaning tasks, maybe considering gloves. So what OSHA has given us for retail is they have given us, you can see the link here, it's a one-page flyer, and I've broken it up, and we'll see the two halves of this flyer on this slide and the next. What they suggest, again, guidance for retail workers in terms of safety issues and in terms of PPE. Now, some of these, I think we can all agree, are pretty easy to implement and pretty straightforward. You obviously don't want your sick workers coming in. You want to encourage them to stay home. You want to provide them a place to wash their hands or have access to hand sanitizer. And you want to make sure you're doing your normal routine cleaning practices and possibly increasing them. So I think these are all pretty straightforward so far. And I would strongly encourage your gym to track as many of these as you can. I understand it may not be possible to reach all of these guideposts, but to the extent you can, I certainly encourage you to try to meet as many of them, even if they're not required. It's creating an informal standard of care, even if it's not official. And this is the bottom half of that flyer. It just doesn't fit well on one side. You can see you want to practice social distancing, which we'll talk about. I know gyms are looking into that, limiting customer flow into the gym, segregating the gym in terms of zones, whether you can only boulder, whether you can only get on the auto belays, things like that. The drive-through curbside pickup, that obviously doesn't apply to climbing gyms unless you're selling products, and then you could do like a carry-out almost if somebody needs more chalk or whatever that may be. Providing customers with tissues and trash receptacles. This is something that I assume every gym's already doing. Training your workers. So you want to at least take the opportunity to discuss with your workers, limiting touching their face, cleaning their hands, possibly wearing masks, whatever you decide on that approach. But you do want to have a discussion with them. I know it sounds silly to talk to your workers and ask them to make sure they know how to wash their hands, but it is something you should address at a team meeting, what your expectations are from a safety standpoint, whether you want them to wash their hands every hour, every 2 hours, obviously every time they use the restroom, or if they sneeze or cough, things like that. You want to have some of those discussions with them. You can put it in a document if you want, but at least you want to have that discussion. You certainly want to allow workers to wear masks if they want, and I would even suggest you consider making it mandatory. That will be a gym-specific decision, but what you can see here is that OSHA is just saying in a retail context, you should consider allowing them, which means OSHA is obviously not requiring them. And I know I've had a lot of questions already about masks, so this is kind of where OSHA falls on that issue in terms of retail, which again, I think is the closest to gyms, saying you should allow it, and I would consider mandating it possibly for your employees if that's practical. And then of course you want your employees reporting health and safety concerns. You want them doing that all the time. So when you see this one-page flyer from OSHA, it's not really adding a whole lot to retail. Like I said, if you're in a more demanding healthcare related profession, as you know, there's going to be a lot more requirements here. I think the biggest requirements are going to be more so on cleaning and disinfectant. And we'll briefly touch on that because a lot of that's already covered on the CWA website and its links. This I wanted to just put up here for a moment. This is from OSHA as well. This is taken from its website. This is not me paraphrasing or editorializing, showing what OSHA is expecting for retail employees in terms of its guidance, not requiring, but again, avoiding touching their faces, washing hands frequently. And then the PPE, the personal protective equipment at the bottom, is what I thought would be interesting for most workers, or to me, for most folks to hear about their workers, explaining that if you're going to have a real customer heavy area, maybe it's your check-in. I don't know if you're going to have folks walking the gym, but it's likely just going to be a check-in. You know, consider what PPE needs to be provided beyond what they would normally do. And of course, you need to assess that. And as they point out at the bottom, for any of the workers that are doing cleaning and disinfecting, you're certainly going to want to consider giving them PPE, whether it's gloves and a mask, which I recommend if you can do that, whether they're cleaning holds or these commonly touched surfaces like counters or lockers or whatever you're doing for your facility. So that's what OSHA has laid out. And like I said, it's not hard and fast rules. It's a lot of guidance. So there is some leeway there and some best practices to consider. Some may not work for your gym, some may. But I also want to remind everybody to check their state requirements. I just pulled this from Arizona just because it's one of the few states I've seen so far that actually has something specific for gyms and fitness providers. It largely tracks CDC guidance, as you can say, or as you can see, excuse me. And it provides some specific details for the folks coming into the gym and then for the folks running the gym. Obviously, this is where climbing gyms are going to fall under gyms and fitness providers. And even here, I just want to note that as you see on the top portion of this screenshot, it's still just guidelines. So at least in Arizona, as they phrased it, it's guidelines. So you really want to check what is your state requiring, what is your county requiring or city, if it's different than the state. You want to make sure you're familiar with that. So unfortunately, this is where we have all these layers of guidance. We've got OSHA's recommendations. We've got potentially state or local recommendations, but you do need to look at them. Again, most of them are largely guidelines at this point, and most of them tend to piggyback on one another. Again, this is referring back to the CDC, and I don't think you're going to see anything too revolutionary when you look at those expectations. I also want to note this page. This is from the CDC about cleaning and disinfecting. This is obviously a big concern with gyms because of the holds and everybody's contact on the holds, touching the holds. I believe you guys have had some community calls on that. I know there's resources on the CWA's page, so I'm not really going to belabor that point because we're going to talk more about the workforce, but I did want to highlight that there is some guidance out there. There's a link to it that can be followed, but certainly that's going to be a big issue as the gyms reopen. And not only do you want to protect your workforce, but also your customers. You know, you want to presumably promote whatever cleaning you're doing to give your customers a sense of comfort as they look to come back in. If you've been having communications with them, I'm sure you've been talking about that. This is what we're doing to protect you. This is what we're doing to protect the workforce and the customer. Of course, we also have social distancing measures. I'm sure, you know, back in January and February, social distancing was a foreign concept. We're all immensely familiar with it now. I assume most gyms that are open have a pretty rigid system in place to increase the social distancing as much as possible. You want to make sure you're promoting it because, quite frankly, your customers are going to expect it. The climbers are going to expect the social distancing. They're not going to see a crowded gym for the most part. You don't want to get all these Twitter or Facebook posts all of a sudden saying, oh my God, I went into ABC Rock Gym and it's packed with people and they just don't care. So you obviously don't want to come off as insensitive either. So you want to consider social distancing in your gym. Consider, you know, staggered climbing times for the climbers. Consider staggered shifts for your workforce, so you don't have every employee coming in at, you know, noon for the same shift. Maybe some start a little earlier, some start a little later. That controls your workforce coming in. You want to control your customers coming in. Like I said, if you have admin folks that can telework, they're probably already doing it. Consider letting them keep doing it. Also, without getting into too much detail, you know, certainly if your routes can be separated, you're going to want to consider that, you know, kind of competition style where the routes aren't going to be overlapping. You know, you generally want to avoid the overlap when you can, but certainly here you want to consider with your route setters, what are you doing to increase social distancing? If, you know, 3 routes are all finishing on the same hold and everyone's converging on the same spot, you know, obviously that's a little problematic. Consider whether you need partitions. Gyms are pretty open, so it might be a little less practical for most gyms. And then just consider how you want to perhaps limit access. So social distancing is not necessarily required unless you have a specific state or local ordinance on that, but it is a good practice. And like I said, your customers are largely going to expect it as the climbers start coming back. So we've talked about face covering some, but I do want to get a little more detail here. Under the CDC guidance, they recommend wearing face cloth in public settings. That's been out for a couple months now. We certainly know that. So certainly a gym would be an area to recommend it. You can consider how you want to impose that upon your climbers, whether you want to make them all wear masks or not. That's, and again, without any specific state or local requirements, that's your decision. You know, your particular gym might be more amenable to that than others. You saw on the Vertical Life survey, about 2/3 of climbers would be comfortable wearing masks, or at least accept that. So you can consider how you want to roll that out for your climbers. And then for your employers, for your employees, you certainly want to allow them to wear a mask if they want. Certainly wouldn't recommend declining anybody the ability to wear a mask. But I would strongly consider making it mandatory to have your employees wearing masks. It's a good safety practice. They're not climbing, so it's less intrusive on them. Again, I think your climbers will appreciate seeing the staff in masks. So I would recommend that if it's possible. If you're going to be providing masks, if you're going to be requiring folks to wear masks, I strongly recommend you provide them. In some states like California, if you require somebody to get something for work, you have to pay them for it. You can't just ask them to get those supplies. So if possible, if you can get your hands on some masks, I'd recommend doing that for your workforce, or you can reimburse them, give them a, you know, $5, $10 stipend to get some masks, and see. Honestly, what I've seen with a lot of the gyms, there's a lot of creative folks, Etsy accounts, things like that. A lot of folks we're creating masks. You may even have some of your own climbers that have been making them. Maybe they were making chalk bags and they took a break from that to make masks. So you don't know. But consider having your entire workforce wear masks, at least when they're interacting with customers. If they're back in an administrative area, that's a little different. I would strongly recommend you have your workforce wear masks if that's possible. So that's really kind of the discussion on the workspace itself and some of the logistics. And what I want to shift over to now is your workforce, the people, of course. What are your rights and obligations to your employees as you bring them back? Because for some gyms, you haven't seen your employees for months. Maybe some kept them on in some fashion. Maybe some had limited operations, or you were doing some housekeeping, like cleaning holes, route setting, whatever. But for some of you, maybe literally months since you've seen them. There's a couple things you can do, and of course there's things you can't, which is always the case, but there are some additional rights that employers have now in this kind of pandemic setting that are not always the case. I think by now you've all heard about temperature screenings. This is something that's not normally allowed. Under the Americans with Disabilities Act, the ADA, an employer cannot conduct a medical examination without meeting certain criteria. And we won't go down that path because it's not overly relevant now. But for these purposes, you can take your employee's temperature, which is considered a medical examination because you're examining an employee. You are permitted to take their temperature before coming into work, when they're at work, whatever you see fit. You can't normally do this. If we weren't in a pandemic, you wouldn't be allowed to do it without meeting certain requirements for a medical examination. But under these circumstances, you are allowed to do it. So starting from the top, you can certainly ask employees to self-report symptoms of COVID. A lot of the clients I've been working with are putting together questionnaires, whether it's through a text message that the employees have to respond to before showing up, whether it's a questionnaire in the morning that they don't have symptoms, they haven't been around somebody with symptoms, they're not traveling, whatever you may want to put on that, you can ask about that. You are allowed to ask about COVID-related symptoms. You cannot, of course, ask about other disability inquiries. So you can't use that as an opening to ask about whatever other disabilities or medical conditions they may have, but you can ask them about COVID symptoms. Additionally, like we were talking about, you can also take their temperature. This is voluntary unless your state requires it, which for the most part is very limited. For example, in Florida, it is not required to take temperatures. Now, you may just think we're in the Southeast, so it's kind of a little more reckless down here. Maybe that is true, but it's not required in this state. In most states, it hasn't been required, but some jurisdictions are contemplating it. Some have already required it. So you want to check to see if there's any local requirements to do temperature screening. But right now, it's not mandated by OSHA. It's not mandated by the CDC either. So if you are going to consider doing temperature screenings, you want to make sure they're being done in an indiscriminate manner. You can't just, for example, screen all the women, but not the men. You need to make sure you're doing it evenly. You certainly want to have a protocol to do it safely. Consider who's actually taking the temperature. A lot of folks aren't going to be excited to, volunteer for that task. You could consider using a third party to do it. There are some companies that will as well. And if you're tracking or creating any records from that temperature screening, you're going to want to make sure you save them separately as a medical file, separate from a personnel file, much like you would do with any medical records. Thankfully, with most of the temperature readings, you're going to get a quick temperature reading. You're not making a record of it. You're just looking at the thermometer, and then that's that. You can also, although this is very unlikely, you also can administer COVID-19 tests. So in the odd event that you, unlike our government, can get your hands on COVID tests, you can actually administer them to your employees. I don't necessarily recommend this, but I note that it is something that EEOC has expressed to come out and allowed businesses to do. Whether you want to do temperature screenings or not, it's up to you. As we know, temperature screenings are not foolproof. Just because somebody has a high fever doesn't mean they necessarily have COVID. And of course, they could be asymptomatic, but you are certainly free to consider that option as well if you want to put that in as a barrier to evaluating your employees. So what do you then do when you have a sick employee? What's going to get triggered, and what are your requirements as the employer? Well, certainly you should be encouraging all your employees to report any sickness or illness, and if they are sick, to have them stay home. And we'll talk in a couple slides whether you have to pay them or not, and that's going to be situational. But you should not, of course, have sick employees coming into work. That's a pretty clear requirement that we all would have said before COVID, but it certainly has been highlighted here. So there's a couple different criteria you can look at. Here's some examples of having employees certifying and writing whether they've been symptom-free for a certain amount of time, whether 7 days have passed since the onset of symptoms, or getting documentation from a medical provider. Of course, we know that is certainly very difficult right now. It's very hard to get a doctor to write a note or prescription. You can try telemedicine, but this may not work out too well. So just be careful. If you're requiring doctor's notes for folks to come back, understand there may be some limitations there, and you want to be real careful with that because there's just a lot of challenges with that. So getting into some of the specific laws that we have when we talk about these returns and employees that are sick, we've got a couple of different scenarios that come up and that I want to prepare folks for. Some of the gyms that are already open, they have seen these issues, and for those that are about to reopen, some of these are going to come up. So there are a number of events that may trigger an employee's request for sick leave, or excuse me, for leave, I should say. They could themselves be sick. They could have child care obligations they have to tend to, which normally would not be covered, but it is now, as we'll discuss under the Families First Coronavirus Response Act. Folks that don't want to come back because of an underlying health condition or vulnerability to COVID-19, and then employees who don't want to come in because they're afraid of contracting COVID-19. All these folks are going to fall under different categories, and there's different protections for them. Some aren't necessarily protected, some are. These concerns are largely addressed through, like I said, the Families First Coronavirus Response Act. We discussed that some on the first presentation I gave a couple months back when gyms were starting to close, and we're going to highlight that again. We're not going to go as deep, but there now are, for the first time, mandated federal leave benefits, primarily paid sick leave and paid child care leave under this act that you will have to provide under certain circumstances. So we're going to talk about that. The Family and Medical Leave Act is still in place like it was before. It's been bolstered by the Families First Coronavirus Response Act, but the FMLA still applies, and that's going to get triggered potentially for employees that need to take extended periods of leave, and then potentially the Americans with Disabilities Act, if you have an employee who has a disability and needs to request a reasonable accommodation, that may be triggered. Some states and local jurisdictions have also provided additional paid leave. Most of those jurisdictions required paid leave for companies that had more than 500 employees, because the Families First Coronavirus Response Act dealt with companies that had fewer than 500 employees. So a lot of the state and local leave laws tried to address what they saw was a gap in coverage and addressing the larger employers, but you want to check, of course, your state and local leave laws, and then, of course, whatever your own policies are. Hopefully you have a handbook. If not, I recommend one strongly, but you should have some sick leave policies laid out in a handbook. So what we're seeing a lot, of course, is vulnerable populations. How this will impact your workforce just depends on the composition of your workforce. Generally speaking, I know most climbing gyms don't have a lot of older employees. It tends to be skewed towards a younger demographic, but even with the younger demographic, you may have folks that have chronic conditions. As the CDC has described, vulnerable individuals are elderly individuals and individuals with serious underlying health conditions such as high blood pressure, chronic lung disease, diabetes, obesity, asthma, and other immunosuppressed conditions. So if you have employees that are part of this vulnerable population, you may have to look at potential accommodations under the ADA, and you may have to look at the FMLA if they need extended periods of leave. So this is an issue you may be dealing with depending on your workforce. So what I want to start by is highlighting the Families First Coronavirus Response Act. Again, we talked about this some briefly, but I do want to highlight this because it is a brand new law. It came into existence in mid-March, and it's been officially effective as of April 1st. So it just celebrated its 2-month birthday. That's how new it is. We thankfully have more guidance on it now, but this is, as I referred to earlier, the first time ever that the federal government has mandated paid sick leave benefits. So if you have fewer than 500 employees, which I suspect is most of the folks on this call, you're covered by this act, meaning you have to provide benefits. So if you have less than 50 employees, you're fewer than 50 employees, there is a small business exemption that we have a little more guidance on. I know a lot of gyms are going to fall under that. That does carve out some of the requirements under here. It's not a complete exemption from here. There's no guarantee the DOL will honor your exemption because it's kind of a self-certifying exemption. The DOL doesn't want you to send them your documents. You just want to certify it and collect what you need to make that assessment. But there is a carve out for small businesses. I'm not going to get into the details today because of time constraints, but you may want to familiarize yourself with that if you have fewer than 50 employees and you may have coverage issues coming up or employees requesting coverage. This may not apply to you. But if it does apply, if you're fewer than 500 and if the small business exemption doesn't apply, and sorry, just to clarify, it's more than just having fewer than 50 employees. That just doesn't automatically exempt you. There's then a number of criteria you have to hit, primarily showing financial hardship. As you can see here, it would jeopardize the viability of the business. So if you're in that category of being a smaller business, you still have to do an analysis of the finances and meet some requirements to justify not providing these benefits. So the benefits are, for employees that are eligible, paid sick leave, which can be immediately upon hire, they're eligible for that, and Extended Family Medical Leave Act, which is eligible, employees are eligible after 30 days. So what is covered under this act and what do you have to provide? So under the FFCRA, there's paid leave entitlement for paid sick leave. And under sick leave, there's 6 qualifying events or categories of leave. And as you can see here, the first 3 symptoms really apply to the individual more specifically, and 4 and 5 are really when someone is caring for somebody else, the family member, and the 6th one applies to individuals as well. So essentially they are, if someone is subject to a local quarantine order that prevents them from coming into work, if your company is reopening, you're likely not going to have that issue unless you have a vulnerable population and you have someone who's over the age of 65 and there's local orders that don't allow individuals over 65 to go back to work. Otherwise, that's likely not going to apply. The second reason that would trigger leave is you have a worker who's been advised by a healthcare provider to self-quarantine. Third reason, you have a worker who is experiencing COVID symptoms and seeking a medical diagnosis. They can't just self-diagnose and try to get all that leave. And fourth, an employee can get leave if they're caring for an individual who is being self-quarantined or experiencing symptoms. 5, if they're caring for a child whose place of care is closed. Obviously, schools are out. I think all the schools are out by now, but schools are closed, daycares are closed. So this is going to be triggered for a lot of employees that have child care obligations who do not have anyone else who can look after their child. They can actually get covered and they can get paid leave under the FFCRA. And if they're experiencing any other symptoms specified by the Secretary of Health relating to COVID. So essentially, if you've got a sick employee who has COVID symptoms or is caring for a child whose daycare or place of care is closed for reasons related to COVID, these employees are going to be eligible for up to 2 weeks of paid leave. So for the reasons 1 through 4 and 6, these are essentially all the ones where you're not looking after a child, you're looking after either someone else, you're looking after yourself. A full-time employee is eligible for 80 hours of paid leave, so essentially 2 weeks. And a part-time employee is eligible for the number of hours that the employee would have worked on a 2-week period. So if they would have worked 20 hours a week, they're only going to get 40 total hours of paid coverage. If they're part-time, if they're full-time, they get 80 hours of paid leave. And if they are taking leave because they have to look after their child, because their child's daycare is unopened and they have no one else to look after the child, they can get an additional 10 weeks for a total of 12 weeks of paid leave from the gym. So if you have a worker who has to take off time because of childcare obligations that fit this criteria, they can be eligible for up to 12 weeks of paid leave. So the sick leave only applies for the first 2 weeks. So no matter how sick you are, you only get 2 weeks of coverage, but you can add an additional 10 weeks for the child care obligations. And these are paid out at slightly different rates. So, and I know the reasons 1, 2, and 3, I'll scroll back in a minute. You can see here, 1, 2, or 3 is essentially if you're having a specific issue. You're sick, you're self-quarantining, or you have symptoms. So if you're taking sick leave for any of those 3 reasons, essentially you're having a problem individually or personally, you're going to get paid at your regular rate up to $511 per day. Most of your folks aren't, I assume, making more than $511 a day. So they're going to get their full rate of paid sick leave for 2 weeks. You have to provide that. If they're taking off to care for somebody else, they get 2/3 of their pay for that 2-week period. And then finally, if they're taking off to care for their child, this is that period of leave where they can extend it all the way to 12 weeks. And at that point, they can get coverage for up to their rate, up to 2/3 their regular rate. So they don't get full pay, they just get 2/3 of the rate, up to $200 a day, but the 2/3 cap will probably limit it for 12 weeks. Now, if you give these benefits, you do need to track them because they are intended to be recovered through tax credit. So the government is requiring these benefits, but the government is providing a tax credit to offset it. You've got to provide the cash and you have to outlay it first, but they are intended to be fully compensated through tax credit. So you want to talk with an accountant, or if you deal with someone on your finances, or if you do it all in-house, to track that, because any of these benefits that are given out under the Families First Coronavirus Response Act are recoverable under tax credit. And this law remains in effect until the end of the year. It doesn't expire until December 31st. So although some of you may have closed immediately, and now that you're reopening, this law is still in effect, and it still applies with equal force. There's also a mandatory poster that you have to put up in your gym. There's a link to it there. This is just like any of your workers' comp poster that you may put. You may have one locally. You should certainly have a federal one. You've got your FLSA poster. You do have to put up the FFCRA poster as well. Most of your folks should be working at the gym. They're not remote. If they're remote, they encourage you to email, but your folks will be coming into work. So you want to post in the gym. You can also email to your employees as well, but you do have to post this. Post it where you have your other posters, where you have your OSHA posters, your workers' comp posters. Just put it there as well. It doesn't have to have its own separate billing, but it does have to be in that area. So that's the FFCRA. There's a lot more about it, but I want to hit some other topics here as we reach the end. We've got the Family Medical Leave Act, as I'm sure some of you have dealt with before. It allows eligible employees to take up to 12 weeks of unpaid leave. So this is why the FFCRA is so unique, because it supplements the FMLA to require you to give paid leave, but only under the scenario where it's a child care obligation. So if you have another COVID issue where it's an employee who's sick or a family member who's sick that may trigger FMLA, that employee does not get paid leave for that. You can argue whether that's fair or not, but under the federal rules, the FMLA has always been unpaid, and it was only changed for that one carve-out for child care coverage. But you want to keep the FMLA in mind. If you have employees who need periods of leave, you can offer them paid leave. I mean, you're allowed to do it, of course. You can always give them more, and some of your policies may do that. You may have a policy of leave, but the FMLA essentially provides employees with 12 weeks of unpaid job protected leave, meaning their job is there for them when they come back. This is very frequently used, of course, for childbirth, and when serious conditions have an employee out of work for an extended period of time for a, quote, serious health condition. The other area of law that constantly gets associated with the FMLA is the ADA, the Americans with Disabilities Act. It's unclear whether COVID-19 qualifies under a disability, but if it's severe enough, it may. It's going to be a case-by-case analysis, because the ADA talks about whether a disability compromises a regular life activity. Typically, like a seasonal flu is not going to give someone coverage under the ADA, but a severe bout of COVID could. It's just going to be very fact-specific. There is no bright line rule on that. But if you do have an employee who has a disability and they're either asking for leave because of the disability, they either need an accommodation such as additional PPE, or they're asking for a period of leave, which can be considered an accommodation under the ADA, you may need to consider providing that. And typically they begin that process by giving you some type of paperwork. You guys don't have to just figure this out as, you know, a climbing gym owner and climbing gym employee. When the ADA gets triggered, there are medical certifications involved. You can get a doctor's note explaining not what the disability is, but what the individual's restrictions are. And then you figure out whether you as a gym can provide what's called a reasonable accommodation. Very basic example, somebody just had a back procedure, and although they normally stand at the front desk, they need to have a stool so they can sit down every other hour or something like that. Well, you could provide them a stool as a reasonable accommodation. Providing PPE might be considered a reasonable accommodation if a worker needs it and asks for it, and if you're not already providing it. So the ADA states that if somebody has a disability, they can request a reasonable accommodation, and you need to evaluate that as an employer to figure out whether you can provide that accommodation. Now, what you may see is individuals who have underlying health conditions asking for reasonable accommodations. Somebody might need periods of leave, or they may request additional PPE. Again, this is going to be a case-by-case basis, but know that if an employee comes to you with a health issue, it's likely going to trigger some responsibilities under the ADA. You're going to make sure you deal with either an attorney, or if you have someone in-house who's very familiar with it, make sure you tread lightly here. There's a lot of statutory requirements under the ADA. And when you're assessing a reasonable accommodation, whether the employee is asking you for PPE or a period of leave or some type of accommodation to help accommodate their disability, you have to evaluate whether it poses what's called an undue hardship. That's the statutory language. And an employer does not have to provide a reasonable accommodation if it poses an undue hardship, which is a significant difficulty or expense. If it does provide an undue hardship, you can try to see if there's a less severe alternative. And just generally speaking, I can tell you this from experience, courts aren't really as persuaded by undue hardships based solely on money, saying, look, it's just too expensive to do this. They're more persuaded by either operational issues. Well, if this person takes off, it compromises our ability to cover this, and it creates staffing issues, and it creates something from a logistical concern. That's a little more compelling than just saying, well, we can't afford it, your request is expensive, and therefore we're going to deny it as an undue hardship. So it's a very esoteric analysis that operates under a very Byzantine statutory structure. So if you have an ADA issue, I encourage you, contact outside counsel or contact an HR company if you have an arrangement set up. You need to handle it in a very specific way. Same for FMLA. And so if you're feeling overwhelmed, I assure you everybody is. There's a lot of laws that have complex interactions, how the FFCRA interacts with the FMLA and the ADA, and it's alphabet soup, really, when you start tracking them. But I assure you, you're not alone. This is a fluid situation. This is an example just from earlier this month that the EEOC, essentially the investigatory body, the agency that pursues discrimination and investigates those claims, they issued guidance on how to accommodate your workforce with medical conditions during the COVID pandemic. And immediately after issuing their guidance, pulled it right back because they said it was being misinterpreted. So this just shows you how much of this is in flux right now. The confusion is warranted. It is a lot of moving parts right now. Guidance is coming out daily. In some instances, it's being rescinded right back. So that's obviously not as reassuring as you'd hope. They eventually fixed it and they reissued the guidance. But if you feel like you're getting overwhelmed and you're hearing guidance from all these different sources, you're correct. And it continues to evolve as we learn more and the orders change. So you really have to do your best to try to stay on top of it. I know that's no small feat. Let me just move through these last slides quickly. I realize we're getting close to the end of the hour. I'm very sorry because I'm going to butt right up against that time and maybe even a little bit over. So if you have to drop, certainly understand that, and we will record this for anyone else to pick up the end of it here. But I just wanted to know, in case there was any doubt, lawsuits are already being filed about COVID-19, and that's certainly not going to slow down. And just the study of federal lawsuits, there's already been 300 COVID-related lawsuits. And this does not include state lawsuits because it's harder to track the state lawsuits for the way that they're recorded. Federal is all consolidated. Just from a federal perspective, we already have 300, actually more than 300 COVID lawsuits. The primary ones right away were contracts and insurance disputes. But number 3, as you can see, is employment. So this was about a week or two back, they pulled these numbers. There are already just shy of 50 employment lawsuits that have been filed across the country about COVID issues. And that's why a lot of companies were closed. So now that everyone's reopening, that number is expected to spike. And again, there's a lot of state lawsuits that are not tracked. And so this number, you can at least double these numbers, and perhaps it's even higher depending on what we're seeing at the state level. So what I want to conclude with here is to highlight the main areas that we're seeing in the lawsuits, what we're hearing from our clients in terms of employee issues, like I said, and just kind of the general concerns as employees are returning to work and you're reopening the workforce. There's a lot of risks, of course, out there with your workforce that are very unique to this situation. And so I certainly want to address some of those and give a little more context. So the 5 areas that we'll touch on here, and these are the last few slides, wage and hour issues, union issues, which, yes, as you can see there, do apply to gyms, even if you don't have a unionized workforce, OSHA issues, teleworking if you had employees doing that, and then Title VII. The area where we expect probably the most issues and what we're already seeing lawsuits about are wage and hour issues, making sure you're tracking employees' time. If anybody's working remotely, you need to make sure that's being tracked. If you furloughed employees and you didn't have them come in for a set period of time, you want to make sure that everything was done properly with their payroll compliance. You didn't compromise any of their possible exemptions. If you did change their exemption, and by exemption I'm referring to exemptions under the Fair Labor Standards Act, which allow you to exempt certain employees from overtime. These are typically going to be your salaried employees that meet the proper classifications. If you changed any of those exempt statuses, some companies took their exempt employees and made them hourly to control cost and adjust their schedule. You know, you're going to want to check on that and consider which employees you're restoring and how you're doing that. You also want to make sure if you're testing your employees, temperature checks, employee screenings, you're going to want to make sure that you consider compensating them for that time. Depending on what jurisdiction you're in, there's stronger arguments that have to be compensated. If you think about it, if you, for example, are doing temperature checks in the parking lot before your employees come in the building, and you have an employee waiting for 10 minutes before you can let them in, they're waiting for your benefit. They're there, they're ready to work, they're showing up when you've asked them to show up, but they're waiting on you to let them get in and to clock in and start working. So there's a lot of case law on this in terms of security screenings that would likely apply here to temperature screenings. And again, it kind of varies by jurisdiction and how short the period of time is. If it's really quick, less of an argument for it to be paid. But if you're having employees waiting around to test them or have them do questionnaires, you're going to want to think about paying them for that time, just have them put the extra minutes on their time card or their timesheet. Also be careful of your employees who want to volunteer, even if it's something that they ask you to do and they express an interest in doing. There's certain restrictions on that. And the reason they exist is because the fear from Congress in enacting the FLSA and the fear from the DOL is if your employees could just volunteer to do their jobs, the great concern is that employers would eventually overreach and coerce their employees to work for free. Say, hey, we really need help on Saturday, but our payroll's tight. Do you mind volunteering? So even if your employees come to you and they want to volunteer, they want to help clean up the gym, there's a lot of limitations on that. And it's generally low risk because you're probably doing it for small little chunks of time here and there. But there is a concern that even with employees volunteering as they want to get the gym back up and running, may need to be paid. And in most instances, they do need to be paid. Just for union issues real quick, if you have employees in a group or someone speaking on behalf of a group of employees that have safety concerns, those may be covered by the National Labor Relations Act. It's what we call concerted activity. That's the statutory buzzword. And critically, you do not have to have a unionized workforce. And to my knowledge, no climbing gym has a unionized workforce. But this provision of the NLRA that allows employees to engage in protected concerted activity will apply even if you don't have a union. So my takeaway from this is if you have employees raising safety complaints, you need to handle them very deliberately and carefully. You can't just dismiss them. You can't just say, this person's complaining about safety, I'm going to fire them. You can be engaging in violations of the National Labor Relations Act, even without a union. So I know you may think of this traditional like hard hat, blue collar union workforce, but certain provisions apply even in a non-unionized setting. So just be cautious if you're getting safety complaints from your workforce. Along those lines, you've got OSHA potential concerns as well. This is a very, again, case-by-case basis. If you're following the general OSHA guidance about keeping your workplace clean and providing PPE, you're going to severely undermine any employee arguments that they're in an imminent danger and that they're refusing to come to work. fear of contracting COVID is not protected leave. It's not protected under the Families First Coronavirus Response Act. If someone's more vulnerable, it may be protected under the ADA, but just the general fear without an underlying condition is typically not covered. And if you're taking steps to protect your gym, it's going to be very hard for someone to argue that it's an imminent danger and they can raise an OSHA issue or bring an OSHA-based a claim based on an OSHA violation. The threat really has to be immediate or imminent. And you can see here that language is that the employee has to believe that death or serious physical harm could occur before they can even contact OSHA. So that's the basis for which an employee can refuse to come in. So if you're having employees that are refusing to come to work, you're going to look at this requirement. You're going to look at what safety measures you're taking, because this is the standard for them refusing to come to work. And just for reference, between January and early April of this year, so about three and a half months, OSHA's already received over 3,000 COVID-related complaints. Again, that's before businesses started reopening. We know that number is going to spike. Real quick on the last two here. If you do have any folks that are working remotely, your admin folks, anyone who's working on your website, whatever it may be, just remember it doesn't lower the requirements for being civil, following your handbook, following your policies. Just because you're on a Zoom call, you're still going to have the same workplace requirements to be civil, to not engage in harassment, discrimination. But what we see with a lot of folks already is in industries where remote work was more prevalent, a lot of the employees would be real diligent at first, but after a couple of weeks of remote work, they really start letting things slide. And maybe in a virtual meeting, they're making remarks they wouldn't make in the office when they felt like it was a little more proper and formal. So even though they may be working remotely, it's still going to be looked at as an extension of the workplace if they're on a conference call or they're coordinating with other employees. So if you've got remote folks, I know that's a very small amount of people, so I just mentioned it quickly. And the last concern here is potential Title VII issues. Title VII is the federal statute that prohibits discrimination in the workplace. What you see typically are lawsuits based on allegations of discrimination or retaliation. You could have issues here depending on how you reduced your staff, if you did it in a discriminatory manner. And likewise, as you bring back your staff. And to give you an extreme example, if you say, well, all of our female employees can come back to work, but not the male employees. You can see how that appears to be very discriminatory. What's your basis? Was it only based on gender? If it's based on gender or a protected characteristic like race, national origin, religion, you're going to have some potential concerns. And another issue to be mindful of is just bias against Asian employees, Asian American employees, Asian customers, possibly Asian American customers. There's been some very nasty stories I'm sure we've all seen, online or across the country about some pretty ugly incidents of bias towards Asian and Asian American citizens. You obviously want to keep that out of your workplace, but that could, of course, create Title VII issues if you're not doing a good enough job of eliminating that. So just something to be mindful of. Hopefully it's not an issue for anybody, but I note that. Final reference is just for anyone who's interested. I've mentioned this before on the prior webinar. Phelps Dunbar, that's a law firm that I work at. We do have a resource portal there. We have a lot of updates that come out very regularly. They're all free. It's not behind a paywall. So if you're looking for more guidance and you're not finding it online, or you want a consolidated source, feel free to reference it. It's free, it's open, it's online. It covers all types of guidance, not just employment issues. We've got tax issues. You can see there's a piece on waivers a little while back. So we do have a lot there if you're looking for more information. Of course, the CWA has a lot on its website, and certainly would encourage folks to check out Scott Rennick and everything they're doing at the Climbing Business Journal as well, trying to get out those resources. So we have those available. I'll make these slides available if anyone wants to reach out to me directly. I'll convert this into a PowerPoint that should have all the links available, and I'm happy to share the slide deck with anybody who wants to look at it. The links, of course, will get you a little more information on some specific areas. So with that, I will turn it over to Garnet, and I thank everybody for attending and joining today. I know it was a lot of dense content and a lot of content, but there's a lot out there that I wanted to get through, so I thank everybody for the time.
Hey, Garnet, I think you're muted.
Thanks for that. I was just going to say thank you to Jason, and I think we'll go over just a bit more, maybe 5-10 minutes at the most, to cover some questions and some areas to highlight. As Jason mentioned, we do have this as a recording, as always, so if you have to dip out, you can always check out what you missed later, and share it with your friends and family, I guess, if you have any family who are into this kind of stuff. Um, so we had a great question in the question and answer dialog box for you, Jason. Um, so if an employee is sent home under the facilities policy, so not any government or local mandates, due to what you might have detected as an exposure in your health screening or maybe a temperature check, is that individual entitled to any paid sick leave under the FFCRA or any other relevant laws?
Well, potentially, you definitely want to check your state laws, but generally speaking, no. Under the FFCRA, Families First Coronavirus Response Act, the new one that went into effect this year, that will not trigger the requirements because they have to be advised by a healthcare provider to self-quarantine, or they have to be experiencing these symptoms and seeking a medical diagnosis. So if you're sending them home, that may be the next step. You may say you may want to get this looked at, and then they may get a diagnosis from a medical provider. But technically, under the FFCRA, when they talk about someone who's self-quarantining, they have to have been advised by a healthcare provider to do that. And of course, just a temperature check at a gym would not qualify for that. So generally speaking, no. Check your state and locals on that. In Florida, I can tell you no. A lot of other states, no as well. A couple states are a little more sympathetic to that, and so it may be covered, but at most, even if it's worse, if they come back with an employee note, at most it's just the 2 weeks of paid sick leave under the FFCRA. That would be the most that would get triggered.
Great, thanks. Diving back to the beginning of this presentation, we touched on some of the different interim guidances that are released by the CDC or OSHA. We also touched on different state and county and city rules or mandates, and then there are some laws in this space as well. Is there any good general advice for how to determine what's recommended versus what's required, the difference between a guideline or rule, or their key buzzwords that get published? Any hints that people can take away to decide what they have to do and what they should do?
Sure, and unfortunately, it is often very hard to discern. But from a general perspective, when you're dealing with OSHA, a lot of it is going to be guidelines, especially right now. And there have been cries for OSHA to actually come out with emergency temporary rules. But what they've done instead is just guidelines. So some of the workers' unions and things like that have criticized them for not doing more, honestly. But those are often guidelines, and you'll see the buzzwords there to look for are, of course, guidelines, guidance, recommends. You're going to want to look for these permissive versus mandatory words, shall versus should. That's kind of not always an obvious thing, but sometimes it might be in there. A lot of CDC guidance is also recommended. And really what you can tell from that is you'll see a language that might say when feasible, if feasible, what works for your workspace. That's a clue that you have a little more flexibility when it comes to some of the safety protocols, some of the workspace issues. In terms of your workforce, when you're dealing with EEOC and DOL, a lot of times their requirements are much more along the lines of true requirements. Their guidance is often provided to help you understand the requirements so you can abide by them, whereas OSHA really is more along the lines, at least right now, here's what we recommend you do. But like I said, to the extent possible, and I know every gym is different, you do want to try to track those OSHA requirements if you can, just so if you have an issue down the road, if you have an employee who claims they got sick from COVID at the gym, if you have a climber that says they got sick, obviously you're going to point to the measures you took. I would document them, write them up. You certainly want to do that so you kind of have a log if it's ever challenged, to say, look, on this date, we put out the hand sanitizing stations. We implemented a new procedure where only X amount of people could boulder at a time, and we're not allowing person-to-person belays. We're only allowing auto belays to minimize contact. You want to make sure you're tracking that because these are good things. So you want to make sure you have documentation, so if there ever is a challenge, you don't have to look back and say, I don't remember when we did it. It was sometime in early June or early July. So consider documenting your practices as well. That's just something to help if you do have any issues down the road in terms of customers or employees who claim to have gotten sick or contracted COVID at the gym.
All right. And kind of a similar question in a way, but a bit more specific. Everyone's got a mixture of national, state or provincial, city, county, territorial guidelines that all get mashed together. And you mentioned, that they tend to overlap and agree with each other. But in cases where there is disagreement, is there a particular level of guidance that tends to be the most relevant for a location? Is it the city?
So typically what you'll see in the structure of overlapping guidance is that at the federal level, they will typically create the floor, and then cities or states can go up from there. And so hopefully it won't be a direct conflict, but generally speaking, what you will see is cities that are being, or states, I should say, cities or states, that are requiring perhaps more, or in certain circumstances, like when we're talking about OSHA, OSHA may be guidelines, but your state or your city may have an actual requirement. For example, in the county where I'm in Tampa, there's specific requirements on how gyms can be open, what hours and things like that. So you want to try to do your best to discern what's going on. If it's a true disagreement, generally, I would generally skew more towards federal, but hopefully it's an instance where one just requires more. And then, of course, you're still going to meet that. I mean, states are allowed to require more. Sometimes there's constitutional challenges in other areas of the law, but right now, none of that's happening. And even if it did, it's all too new. So you'd be looking at starting at federal and then seeing what your states may have more specifically would be my recommendation. So start kind of like a funnel approach, start at the widest net of being federal, and then narrow down to what your state and then maybe your specific city has.
All right. Yeah, and you also touched on, that's a good idea to document the decision making around all of these policies. You touched a little bit on, that it's a good idea to have an employee handbook. For people who have an employee handbook, or even people who don't, is some sort of specific amendment a good idea to write down and maybe have your employees sign? Should you be giving some specific training as your employees re-enter the workforce?
That's a great question. So a couple of different thoughts. To start with, I would certainly recommend that everybody have a handbook. This is just a general piece of advice from an employment practitioner. You should have a handbook. It's helpful and for a number of reasons, giving you some legal defenses in certain types of lawsuits, but also giving you some guidance. If you don't have a handbook, I would strongly recommend it. Hopefully most of you do at this point. And if you have a handbook, there's a couple options here. I wouldn't recommend necessarily updating the handbook for this per se, and more like you've recommended, consider maybe like an addendum or kind of an additional update that's separate from it, so you don't have to redo the whole thing. Maybe it's a one-page document. But you can certainly do that if you're going to be requiring PPE to be worn. You're going to make sure you get that written out so there's no confusion. So, Joe Smith doesn't show up on day one and not realize that you had to bring a mask. You want to communicate that. So you want to do it in writing. You can do it through email that everybody gets, but if you want to do a policy and circulate that, that can be really helpful. What I recommend considering is an acknowledgement. You want to train your employees. I'm not saying it has to be a full day seminar, but you want to train them. These are the expectations, much like you do a sexual harassment training. Hopefully you've all done that too, saying this is what we expect in terms of your conduct and what's appropriate, what's not. You want to consider a training like that as well for the basic PPE and procedures. And yes, some of it may seem redundant if they've been tracking the news at all, but you want to be able to say if it's ever challenged, we told folks how to wear their masks, when to wear their masks, when gloves were available, things like that. So consider a training, consider a policy. And then the final note on that is consider an acknowledgement form. So if you have a handbook, hopefully you also have an acknowledgement form at the end that the employee signs to acknowledge that he or she has read the handbook and will abide by the provisions therein. It's not a binding contract, but it's a document you want if you ever get challenged. Say, look, Joe Smith read the handbook. He knew about this policy, so when he violated it, that's his fault. This tries to alleviate some of these arguments where someone says, well, I didn't know that was the policy. I never heard about it. Nobody ever told me. So much like you would consider an acknowledgement in that setting, I consider an acknowledgement here that you've provided training. If you're providing the PPE, an acknowledgement about that as well. You can't ask your employees to waive their claims. You know, you can't say we just preemptively waive any claims against the gym if you get COVID. That's typically a workers' comp claim. You can't waive that. But you can at least have them sign an acknowledgement that they understand the basic procedures that they're following and that the gym is trying to implement. It's not going to absolve potential liability down the road, but it'd be a good document to have.
Yeah.
You'd want to be able to show you're a good corporate citizen. Here's what we did. We trained our employees. We made sure they understood. And, you know, so-and-so was trained to wear a mask. So if he got sick and we know he wasn't wearing his mask, it's not for a lack of training. It's for his own, you know, poor decisions.
Yeah, and I guess a follow-up question to that, and also the less happy side of of what you were just talking about in terms of good being a good corporate citizen. When it comes to employee discipline that people might have to engage in around any of these new policies, an employee who doesn't wear a mask to your standard, and you may want to write them up or reprimand them. Employees who don't clean according to your standard or otherwise just scoff any of these new policies. I would assume, you know, any sort of written acknowledgement helps with that activity. Are there any sensitivities when it comes to employee discipline around new policies like this that people should keep in mind?
Well, I think the big issue, and you're absolutely right, again, you want to document it, because if somebody's not following your procedures, that's going to potentially lead to a termination at some point. And you may consider, well, if you're not going to clean the holds properly, if you're not going to wear your mask, that would be a basis to consider terminating an employee. So you do want to document it. And the main sensitivity there is if somebody, you want to understand why they're not following that procedure. So you want to at least talk to them or hear them out, because if they say, well, I can't do it because it irritates my asthma condition, or I can't do it because I can't wear masks for religious reasons. You know, there are some protected reasons why somebody may not follow a policy. It can be a religious accommodation. I brought that up just as a reminder for folks who probably don't deal with those very often. But, you know, it could also be a disability-based one. So if you're going to be issuing any discipline, try to find out, you know, talk to the employee why they're not engaging in it. If they just think it's stupid or, well, it's not necessary, that's obviously, you know, you're going to write them up, easy call. But if they're going to invoke what may be a protected characteristic or category, such as a disability or some other basis, that's something you want to explore. You want to tread a little more lightly and see if you need to accommodate them in any way. Maybe you do, maybe you don't. It's going to depend on the circumstance. But that's what I would be most mindful of in a situation like that.
Okay, perfect. Yeah, and yeah, a great question here in the question box. Do you have any recommendations regarding appropriate next steps if an employee files a safety complaint, either I guess individually or on behalf of other employees as well?
Well, yeah, I mean, the first thing you want to do is, you know, obviously see what it is, investigate it, see if there's any merit or not. And then it's going to obviously depend on what it is. You're going to want to move pretty quickly on this. Again, investigate. It's a matter of something where a policy is just not being followed. Hey, to keep picking on our hypothetical John Smith, you know, John's not wearing his mask and he's not doing this, and that's, you know, going to trigger some employee discipline. That's an easier one. If you have employees that are saying, we don't feel comfortable with something, we don't think you're doing enough, that's where you're going to have to look at the issue and see what's going on, because it could be a protected complaint under the NLRA. It could be a disability-based complaint. So you want to figure out what the root of the complaint is naturally, and then you're going to have to evaluate it pretty quickly. What I will say is if they file an internal safety complaint, you also need to understand they're going to get some level of protection with that. You can't just say, well, this person, you know, is a real pain. Almost every state has certain levels of whistleblower protection. Also in the Family's First Coronavirus Act, they built in some whistleblower protections. So you do want to make sure that you're hearing them out. Don't take adverse action against somebody just because they're complaining. You can't just say, man, that person's a real pain, I'm going to get rid of them so I don't have to hear them. That's going to be problematic. So do not terminate the employee. investigate it, figure out if you need to take any remedial measures, such as changing your policies or sanctioning an employee who perhaps is not following, and then, of course, see if it escalates from there. There already have been employee lawsuits filed against their employers for allegedly contracting COVID-19. The first one, I believe, was filed against Walmart for an employee who passed away after contracting COVID-19, and they're trying to hold Walmart liable. There's a lot of arguments about whether that's going to fall under workers' compensation, which is generally more favorable and where you want most of these claims to be handled, or if it's going to be a lawsuit handled in a civil court in the judicial system. I wrote more about that recently in a CBJ article about waivers and potential liability risk. So if you have more issues related to workers' comp, there's some resources there that I recommend. But that's another issue you may see if eventually you could even see a workers' comp claim if somebody claims they contracted COVID-19 at work.
Great. Well, thanks again for all of your time, Jason. I was just going to take a moment as we get to the end here to remind everyone about our webinar next week. We're going to be discussing crisis communications, which include things like communicating your reopening policies and your beliefs about why people should be returning to your gym and how to get them in there, as well as conflict de-escalation practices. But that topic is going to be discussed by a couple communications experts, Adele Sears and Chip Massey. Chip Massey is a former FBI negotiator, and both of these folks helped provide some advice for our recent blog article on this topic as well. So join us next week. I think that will be another equally fascinating conversation as this one was. And once again, definitely reach out to us directly at the CWA with any questions, concerns, anything at all. We're here for you. We're still working on getting all of this information out to you. So anything you need, just send us an email, give us a call, and we'll be on the other end of that line. So we will see all of you, hopefully, next Thursday at 10 a.m. Mountain for that next webinar. And I hope the rest of your week goes splendidly. Talk to you later.